There's uncertainty under the new health care law about what it actually covers. Earlier today, Politico's Paige Cunningham discussed how providers are trying to jump through loopholes to help patients.
This is one of those things where there's a relatively small amount of actual history in how this works. If there's not much history, there's an awful lot of uncertainty, though.
Well, as you just said, the health care law will give many people insurance, but that doesn't necessarily mean that they're going to be able to pay when they want to visit a therapist or a psychologist. I've talked to a number of mental health advocates and providers over the last couple of weeks, and they really say the problem is twofold. Number one, a lot of providers just don't accept insurance because the reimbursement rates are so low, and even if they do, most insurers don't actually cover mental health services as well, and won't pay as much for those services as they will for other types of health care.
And it's those offices that don't accept insurance at all that are the real problem here, isn't it?
Yeah, I mean, absolutely. That's what providers told me. In fact, I spoke with a therapist who treats eating disorders in Arlington, and she told me that she would love to be able to accept those patients, but she just can't make it work for her bottom line. So she only accepts out-of-pocket, but what she does try to do is she'll work with her patients, help them file insurance claims on their own, and she'll also work with them to lower their out-of-pocket cost if they're going to have more trouble paying for it. For instance, you know, these types of services can be quite expensive. It can be up to $250 for a 45-minute session. So she'll try to work with them. So I think a lot of providers want to. It's just it doesn't make sense for them right now.
And Paige, this was one of the worst-case scenarios that was advanced by opponents of this law when it was being debated by Congress, in that you're going to have an awful lot of the unaffiliated physicians, not just healthcare providers, but people on the other side of medicine as well, who, if you're not a part of a PPO or an HMO, something like that, just the sort of the doctor in the office, wherever it is, that they may begin not accepting insurance of any kind because they don't want to get involved with the government red tape. They're starting to see a little bit of that on the mental health care side.
Mm-hmm. Yeah, and of course the bottom line problem that everyone's worried about is the out-of-pocket costs.
Right.
And that's especially acute when it comes to mental health services. There were 5.7 million Americans that don't get the mental health care right now that they need, and about half of those say that it's because of insurance problems or an inability to pay. So it's definitely a problem, you know, that's really going to, you know, be real to people.
Yeah. Paige Cunningham, thanks so much. Good to see you.